Hi everyone, I'm Ian, and today I look forward to presenting to be excluded or commodified, the risks of AI-driven precision medicine and the clinical neurosciences. This has been a project that I've been pursuing with the help of Dr. Collins at Vanderbilt, sort of as a side project for my work as a research assistant at the Hastings Center, mainly focused on AI ethics. So here I'm trying to combine, my background in neuroethics with something I'm kind of new to, which is AI ethics. So really the goal of today is to try and lump together all of these things, AI ethics, neuroethics, with a particular focus through justice sort of concerns when it comes to precision medicines, progression in the clinical neurosciences, whether that's neurology, neurosurgery, or psychiatry. Um, this has been highlighted as a field or a particular topic, particularly social inequality sort of conversations that tends to be a weakness with these sort of ethical subcategories, and so trying to really prioritize it with these other clinical domains is something that I am really trying to aim for with this project overall. To give, I think, a really broad overview of these various things, some challenges that I'm seeing. One is sort of like the history of precision medicine in itself and sort of the ideologies that can come from it, right? So, precision medicine's come to vogue in the past couple of decades, right? Kind of an outgrowth of things like oncology, sort of fields and specialties. And it's been named that, right, out of what was previously stratified medicine. We also classify it as personalized medicine, but really the stratified medicine has been the thing that, at least in places like America, we've tried to avoid using, given the history of um, social stratifying and the negative connotations that can come with that. So precision medicine's really been this thing that's come to the fore as what it's been described as and used to kind of tailor one's field, precision neurology, neurosurgery, psychiatry, etc. But what this sort of thought process and prioritization can result in. One thing is like sort of neoliberal traditions of prioritizing oneself and one's data and all the things that can be collected about oneself. And this kind of results in a weird catch where you become all the more responsible for the data that you learn about yourself. So if you know that you have um, some biomarker that predisposes you to some sort of addiction knowledge and you happen to actually become addicted to a substance down the line? Are you now more responsible for that because of all of this data that's been collected on you? Or, as we'll say here in a second, things like minority populations being all the more responsible for their disparities they face without actually addressing, the external contextualities about why that is in the first place. So again, there's these various traditions and I think value judgments that are already latent within precision medicine that I think need to be addressed when it comes to the clinical neurosciences. Um, Next is this thing I've kind of been tailoring as predatory inclusion. It's kind of coming from other literature to describe sort of this weird um, prioritization of data collection when it comes to populations that have been those that are in minorities, those that have been historically disadvantaged, right? And neuroscience is trying to better reach those folks, trying to better incorporate far more diverse data sets. But this comes with the risk, right, of, they aren't sometimes in it because it comes with the risk to them, right? They have a higher risk of, malicious intent behind data collection, historically speaking, compared to those who are in more middle class white backgrounds where they tend to benefit and not as much of a risk when it comes to this sort of data collection. But at the same time, if they don't participate, then they're going to have worse outcomes because they're not being analyzed in said data set. So medical innovations, then, they don't get those, and so they have a biased care down the line too. So there's all these sort of tensions with their inclusion and exclusion, thus the title of this conversation. So without systemic wide changes, this sort of like prioritization for inclusive data sets becomes very challenging. Thus, it's a challenging section. Finally, just touching on this whole AI in particular has conversations about digital extractivism, right? Here being a form of colonialism when it comes to the digitization of society. I say this because all the various biomarkers that can be collected are only growing in number. A lot of the more medical ones, like neuroimaging, we're more familiar with, but things that are maybe more psychiatry focused, things that come from everyday interactions from our data, whether it's our phone. I'm also experiencing or gaining experience in voice biomarkers and how they can be collected in everyday life, right? The the sheer amount of data that can be collected is just growing when it comes to its health relevance and really being cognizant of the fact that it's being collected in an environment of this monetization of data, ever more data tends to be the priority. And who is it sold to? Who does it give power to? Those sorts of conversations, I think, are all the more important. Moving now on to just next steps, ways to address these various things that I've been highlighting. One is just, of course, as any solution is, just to try and go to the root causes of inequality and not to prioritize too much techno-solutionism. And I say that mainly not just to say I have a solution, but to say like really prioritizing those who have been historically in asymmetric power relationships, those in the global south, those with who are prioritizing data sovereignty for their various populations because of just their history with the global north and the exploitation that can come from it. I don't want to address maybe what it is that they've taught us so far because I think that's their something they can give far more nuance to than I can, but learning from them much more than maybe we might have traditionally done so as a priority, I think should be continued in general because they have a lot of foresight for us with these different difficulties, especially given the growing inequality when it comes to places like America. Next, when it comes to just setting ethical discussions and priorities, I think having some sort of independence from these very strong and powerful tech companies to really set our own ethical agendas, our own philosophical agendas, is important and I respect can be difficult. I know there's concerns with ethics washings when gets embedded into companies. And really, they don't have the ability to hold companies accountable. Granted, they're not legal, but the lack of consistency within these companies, I won't name anything specifically here. Happy to go into that further in the questions, but right when capital becomes a thing that is at stake, these ethical values tend to fall to the wayside, and thus the whole point of why are we doing ethics, and in that environment, it becomes into question. So I think that's one thing to keep in mind as well. Um, Next is things like just, I say something here very broadly about expanding legal and regulatory frameworks. This is really American focused of just trying to be one, just more, I don't want to say aggressive, but more encompassing with our conversations and regulations about this technology, but also more specific with our language because we tend to say things very broadly with the normative standards of like AI for good, fair and responsible AI, AI for humanity, and now with the current administration, things like human flourishing, right, is now the priority, whatever that means, things to be determined. But taking lessons from places like Europe, who has a far more encompassing legislation about what AI means and the policies behind it, can be better used, especially in the US, just to kind of get more consistency across the board in how we're understanding and using this technology, especially in medicine. And finally, touching on things like just where is it that the precision medicine is being used correctly in medicine, I think is a tough place to find, and I'm not entirely sure all the places quite yet. But obviously, knowing when and when not to use it is of the utmost importance. I know we talk about a lot about health. Versus disease and medicine, and I think the disease places can be far more beneficial, like finding biomarkers for cancers and how to address them with particular chemotherapies. I respect that that tradition of precision medicine is there and has been helpful. But things like health, where there's very ambiguous sort of preventative measures that can come into play when it comes to mental health and neurology, when we don't really know the significance of those sort of biomarkers quite yet. So until there's clear evidence that that can be established for the efficacy of individualized preventative strategies. Continuing to focus instead on things like structural public health strategies over this more data-heavy precision medicine strategies are probably the focus for the long-term betterment of our populations, whether that's global north or global south. So those are the main ones I wanted to touch on, and thus the whole reason that I'm, prioritizing this conversation is because without, a really continuing to push for these sorts of conversations with when it comes to equity, unfortunately, not in vogue per se when it comes to the US, but then all the more reason for it to be focused now. Otherwise, we risk perpetuating it even further when this technology continues to progress. Regardless, that's my presentation. I might have gone a little bit over. Thanks again for letting me present. Sorry I couldn't be there in Europe. Please feel free to reach out, whether that's during a question after this video or even afterwards. This is a full manuscript at this point that's under review, so I'm happy to go into more nuance as you see fit. Regardless, enjoy the rest of the conference and thanks again. Bye-bye.